A registered dietitian, associate nutritionist, and member of the medical working group for the Nutrition Society. Our next speaker has a bachelor's degree in nutrition and dietetics and master's in human nutrition from the University of Surrey. She is now the vice chair of the PHC Scientific Advisory Committee. Please welcome to the stage Helen Gowers.
Oh, is this? Can you all hear me? Is that lined up? No? What do we need to do? Like that? Is that better? Good, okay. Right, let's just get all my things. There we go. Okay, so thanks, Sam. And I really am delighted to be able to give you an update on TLC today. So, with my talk, I've divided it into 4 sections, and I thought I'd start by just reflecting on everything that we've learned over the last 4 years delivering the Lifestyle Club to primary care. Then, excited to share our research study, which many of you very kindly contributed when we were doing our fundraising a couple of years ago, and we've just sent it for publication, so we don't even know if they're going to accept it yet. So I'm hoping, I'm not going to be sharing too much with you, but I've been assured I can tell you this much. Then obviously there's been a lot of changes with TLC recently, so I want to tell you what's next and the exciting things in the pipeline, and end on some fabulous participant stories. So hopefully that's what you're here to hear. So what have we learnt? I thought just quickly, for people that don't know about the Lifestyle Club, I'd give you an introduction, and it's an 8-week course for helping adults with type 2 diabetes and pre-diabetes to aim for remission using the low carbohydrate diet. And we work with Expert Health to create our fabulous course. They've got years of experience delivering structured education in the NHS, and really gave us a leg up with the start of our programme. Already we've trialled it now across England in 77 surgeries, and each of the sessions is facilitated by a trained health coach, delivered over Zoom or Teams, and for groups of up to 12 people. So what works well? Definitely having quality evidence-based resources has been so important, and I think particularly the participants tell us that they love our interactive course format and comprehensive participant handbook. The clinicians really trust our brand, and they can see the difference that their patients are getting from coming on our courses. So we're also Kismet accredited, and that means that any referrals to us count towards their quality outcome framework target, so that's an added incentive. We've been driving engagement through information and support, and when we start a new programme, we always run a series of information sessions, just so we can explain to people what the course is all about and what they're likely to get out of it, so they can see whether it's for them. And actually, half of the people that register for one of those information sessions don't even turn up. And I think that shows you that they're obviously not ready to be making behaviour changes yet. So for the 50% that come, over 80% of them will enrol on the course. And I think that's what drives our really good attendance rate. So 70% of people will come to 7 or 8 of the 8 sessions, which for an NHS course, that's incredibly good. Also regular testing and feedback, and I think it's just so helpful to know if the changes that you're making are actually making a difference. And so when the surgeries are prioritising blood testing at their annual checkups, it's really obvious that the feedback is really helping people to stay engaged, and then they'll come and post how well they're doing on our WhatsApp chat, and that gives everybody else a lift as well, so that's really helpful. We take our partnerships with the surgeries really seriously. We always run onboarding sessions so that the clinicians really understand about low carb and how to do deprescribing, because it is quite different for people that haven't used that in their practice before. But what we really notice is when we've got champions, maybe a GP or a nurse or even somebody on the admin staff that's really pro-lifestyle interventions, and that really drives the numbers of people coming on our courses. So just a few photos to show you some of the events that we've done this year. That was Val talking as a participant at our sale roadshow that we did last year. And we had 200 people sign up to come to our events. So it just shows the appetite that people have to learn about dietary approaches to diabetes remission. The other photos are from our Guildford support hub. And we've got hubs all around the country now supporting participants to get together, meet up for coffees, go for walks, have meals and so on. Okay, so some of the barriers. Just realised there we go. So NHS funding has really been a problem for us, and it's been so noticeable, the changes that have been made to the additional roles reimbursement funding over the last 2 years has made it very difficult for surgeries to be able to find the funding to pay for our courses, despite being absolutely delighted with the results. So it's incredibly frustrating all round. Obviously, we've talked a lot about GLP-1s and the SGLT2s, and maybe the money's being directed more into those. We did trial, or I think it's still going, but we've been offering TLC directly to the public to see if people will self-fund themselves. And uptake's been really poor, and I just think the UK population isn't ready to be sort of paying for their own healthcare. They don't prioritise that as something they want to spend their money on. Participant recruitment is an interesting one because it's quite variable. When we start in a new surgery, we ask them to send out text messages just to a load of people, and so we'll get a flurry of early adopters that want to come on the course. But very quickly that tails off, and it's quite difficult to know how do we engage with people that might like to do it after that. And I've spent sort of a couple of days phoning people up, and even talking to them over the phone, it's not necessarily giving them the impetus to even come on an information session. So that's definitely tricky. And I think it probably feeds into the next one, which is methods of delivery. We've obviously chosen to do an 8-week course. The sessions are 90 minutes. So it's a really big commitment for somebody to come on the course. And, maybe we should be looking at TLC Lite, where it's much more on-demand content and people can look at all of the information in their own time and perhaps do the interactive sessions as part of the support programme. And then personal circumstances, that's a really big thing, and I think possibly we've covered some of these things already, but we've been working with the Bristol surgeries looking at their early onset diabetes. That was where the funding was, so people aged between 18 and 39. So it was just interesting to be able to hear what their barriers are, and obviously working full time, shift work, perhaps travelling a lot for work, having a young family. They're all things that are going to be barriers to doing a massive great course, and even just to think about changing all their diet and lifestyle around those constraints. That can be difficult. However, TLC does seem to appeal to a cohort of people, and I think possibly being retired or at least having older children, possibly being single, it's people that have much more control over their environment, I think, do well. And then that being said, we have had people that have overcome the most enormous obstacles to achieve their goals. So again, we've talked a lot about empowerment and support, but I think that's where that comes in, is just to be able to help people to reach the goals that they want to reach. Right, on to the research study. So we're really delighted that we were able to partner with the University of Surrey to validate our TLC data that I've been collecting over the last 4 years. And we've done a mixed method, single-arm, prospective observational study, which actually, as Ellen was telling you about Liberate, it sounds exactly the same. So that's what we've been doing. Participants were measured at baseline just before they started the course, and then 3 months and 6 months. And then we also included semi-structured interviews so we could see, have a look at the acceptability of what we're asking them to do. So it's our research team. We had Dr. Martin White as our principal investigator, and he's not only an associate professor, but he's also a consultant diabetologist, so very hands-on. In fact, so hands-on he took most of our blood samples for us because Sinead, who had signed up to do it, when it actually came to it, she thought, no, I'm not experienced enough. So Sinead, our research dietitian, ran the trial site. She did all of the measuring and conducted the interviews over Teams. And then we were really lucky that Jane Ogden, who's Professor of Health Psychology, assisted Sinead when she was doing the thematic analysis. So quickly, just our recruitment process. We were taking from 8 GP surgeries in Guildford and the surrounding villages. Basically, anybody that enrolled on TLC during that study period last year was contacted, and 74 people put themselves forward to be assessed for eligibility. We did a rolling enrolment over January to June, so each month with the programme for TLC, people were asked if they wanted to also join the study. And really, people were excluded mainly if they weren't actually diabetic. So, you know, if we measured their blood and found it was already lower than 6.5, then they were excluded. And I think the other reason possibly is just that they didn't make the visit. So I know a couple got COVID. Qualitative arm, basically anybody that said they'd like to take part in the focus groups was emailed and went along to do an interview with Sinead, which was recorded over Teams. So the analysis then, we had 20 people for the thematic analysis, looking at all the qualitative results, and then 48 people went to the quantitative analysis. Quick word about the demographics. They were virtually identical to our usual TLC cohort, which was really pleasing. 55% male. Usually we get 55% female. And I just think the men really like the idea of going up to university and being measured, so I just think that's why it nudged over. Ethnicity, again, identical. Slightly more Chinese, but I think that's because we do have quite a high population of Chinese that live over by the university, so possibly that's what changed that. And participant age, normally it's 61, so, you know, not too different to 67. So here we go, drum roll. Outcomes at 6 months then. HbA1c fell from 57 to 49, which is a reduction of 8 millimole. When we did our sort of predictions at the beginning, we were thinking at least 6 would be clinically significant, so really pleased that it was 8. It actually was 10 at the 3 months and then went back up again to 8. But even so, that, you know, I'm always so harsh on myself, but I think that's great. Particularly pleasing was 46% were able to take their blood glucose level from the diabetic range to below that, so below the 48 millimole threshold, which compares really nicely with David's results, but also with lots of other groups that are publishing remission rates. Ours, we couldn't say that was a remission rate because some were still on medication, but when we looked at the people that had come off of their medication as well, we've got a remission rate of 23%. And I think partly that was because these were clinicians that really didn't know very much about low-carb and deprescribing at all. So that, I think, definitely would be improved. And also, this is a really short time frame for a clinician, particularly somebody not used to low-carb, to be considering taking someone off medication. The weight loss was 5.2 kilograms at 6 months, and again, that compares well with the normal TLC weight loss, which is sort of 6 to 6.5. Median was 4.2, and I've got a graph to explain why those are so different. And then the little chain is to remind me to tell you that when we did the regression analysis, there was a really strong correlation between weight loss and reduction in HbA1c, which just wasn't there with reduction in carbohydrate. So we couldn't get a relationship between HbA1c coming down and people eating less carbs, which was a bit frustrating, but, you know, it's interesting to see. Lipids really didn't change, so that's similar to other people's results. And then the dietary changes, they definitely did reduce their carbs. That was by about 50%, and they were definitely eating low carb by the end. It's of 100 grams, and that represented a reduction of 33% in the energy coming from carbs. Interestingly, the amount of fibre that people reported eating went from 16 to 12, so that's perhaps something to look out for. But equally, we used sort of dietary recall. It was a 3-day dietary recall. So, we know the limitations of trying to get somebody's diet history from that method. In terms of what people said in the interviews, they found TLC was motivational and empowering, and both motivation and empowerment were central to adherence on the diet, and that it was the health improvements and the medication reduction that were key motivators. So again, this sort of points to the importance of deprescribing when it's possible, because it is a real motivator for people. The negative things were that they sometimes found the low carbohydrate diet interfered with their social interactions, and those with complicated domestic routines or comorbidities, that presented extra challenges. And I think I've sort of already mentioned that really, that it's just another reason why we need to support people in the long term with these sorts of dietary changes. So this was the graph that I just wanted to share with you, and it shows you that virtually everybody lost weight, and then some people lost a lot of weight. And so that first bar is showing 17 kilograms weight loss, and all of those people that lost a lot of weight skewed the average to be 5.2, whereas you can see the median at 4.2 is really obvious there in the middle. So what's next for TLC? Basically, we needed to reduce our costs, we needed to streamline the business. Sarah had been running the operations so well for so long now, that now all the initial setup of the service and everything is already completed. She was the logical person to take over running the team. And I really couldn't think of a more enthusiastic or capable person to succeed me. And already she's doing a fantastic job. So let's go through some of the projects that are in the pipeline. So just as I was leaving in March, we were launching the TLC Wellbeing Service, and that's basically been based on the diabetes programme, but much more emphasis on general wellbeing, weight loss, a little bit about food addiction in there as well. Really because we were just trying to open this up to the employer market, move away from reliance on the NHS. So we've been able to do a pilot with Scotland's Railway and a health screening company called Cured. So they invited Scotland's Railway employees to sign up for the course. People have enrolled on the course now. I think I was just talking to David, one of the coaches, and he was saying they're 6 weeks in, so they're obviously going through the course. Sarah will be looking at collecting the data later on, and then be working with the other teams to get that ready for the end of the year. And hopefully this will be a really promising way of scaling up wellbeing within the employer market. Another one is Primary Health Properties, PHP, very similar to us. And they're a real estate investment trust with over 500 properties in the UK. And they basically own the buildings that the GP surgeries are renting to run their business from. And they have a community impact fund that they're keen to use to support surgeries. So Sarah's been supervising a pilot of the diabetes course in their West Timperley Health Centre. So if that's a success, and so far everyone's been really enthusiastic about it, so some good results, that could be a really good opportunity to scale up NHS patients, but with a completely different funding source, which is really exciting. And then really early stages of discussions with Swiss Re just about the potential for running a pilot in income protection insurance. And again, this could be an opportunity for both TLC diabetes and the wellbeing programs to just find a new market, because, as I say, the NHS is really tricky at the moment. So what I thought I'd do next is just to finish with some lovely participant stories. They were speaking at one of our catch-up sessions, sort of inspiring everybody on the chat. And I just thought it'd be nice to share with you today, because I think it gives you a really good insight into the range of people and the range of ways that we're helping people with TLC. So Terry's become a bit of a celebrity. He posts his dinners on our WhatsApp chat as he's been getting more and more au fait with the low-carb cooking. And he just says he's fallen back in love with cooking. Sri is a rocket engineer, and he used root cause analysis to come off 18 units of insulin to achieve drug-free remission. And actually, Sri appears in Katie's latest book. So if you've bought Katie's book, you'll see his story in there. Cheryl has overcome bereavement and a house move, and she made low carb practical and sustainable, and in the process reversed her diabetes as well. And then Glenda was on our very first pilot back in 2021, and she's such a determined and inspiring lady, has just completely turned her health around. So fingers crossed for the tech, but hopefully this should all work.
I was just basically eating sort of like a Chinese takeaway once a week, sort of like microwave meals. I'd be on 3 meals a day, sort of like eggs on toast in the morning for breakfast, like lunch sandwiches with crisp and everything. And because of living alone, I couldn't be bothered to do a main meal, so it'd be like sausage sandwiches, bacon sandwiches, chips, just quick, easy stuff. I started like getting ideas from the WhatsApp group of pictures that were posted from some people. So I started changing my breakfast, and I started eating berries. Every week I do a meal plan. I write down Monday to Sunday. I write my meals on there. I then plan that with my shopping of what I'm going to get. So I get a lot of fresh veg and a lot. I do get some frozen veg as well. So I've started eating stuff that I've never ever tried before, like butternut squash, asparagus, salmon, tuna and everything. I've made so many different varieties of mash. It's unbelievable. I've just tried everything and that lot. Yeah. The first one is chicken breast stuffed with Bourguignon cheese and wrapped in bacon with sprouts melted in butter, asparagus and red cabbage. When I first started, I was actually doing stuffing with the chicken. Someone pointed out to me that the carbs were quite high in the stuffing and recommended like the cheeses and everything. The middle one is lamb grilled steaks, one of my mashes, which is mashed cauliflower and broccoli, some red cabbage again, and some spinach. And the last one is my salmon fillets, mashed butternut squash, asparagus, sprouts with melted butter, and the rest of the melted butter tipped over the salmon fillets. I batch cook, obviously, my bolognese and everything. The old Chinese that I used to get, I've got the containers still, so they come in very handy now to put my bolognese mixes in and put them in the freezer, so I've got leftovers.
Diagnosis, and you can see me pretty much in the top corner, which is myself before. So HbA1c that I started with was 111 millimole per mole. This was something which my GP got so concerned, he said, "I'm sorry, Mr. Varad, you need to start acting immediately." So within a week and a half of starting low carb diet under TLC, my blood glucose started pretty much stabilizing quite quickly. And the blue line, which basically skyrockets up to 16, is basically the insulin line. So insulin is going up and up to suppress or clamp down the peaks that you are seeing. And you can see quite high peaks, even up to 14 millimole per liter. Now that is quite high. And I could sense it. How I was feeling was not really normal at that time. Then what happens is pretty much we make a decision at home that we stop carbs. And you can start seeing the effect pretty much immediately. After that, you can see on pretty much week and a half after that, there's another arrow here which says insulin stopped in consultation with diabetic nurse. Now, this is the time when I realized that low carb diet is basically putting me in a normal range of blood glucose. And you can see pretty much a clustering happening pretty much in the domain of where the blood glucose should be. And since then, I've been managing a low carb diet.
I've made a very conscious effort to cut out everything I know is heavy carb. So I don't have bread, I don't have rice, pasta or potatoes, not ever. And I use the substitutes, like, you know, I do have root vegetables, and I do eat the seeds, a lot of the seeds. So I know that I've got carbs in my diet, but I do also know from early kind of checking that my normal daily average would not be more than, I don't know, 50 and 100, say, but nowhere near that much. And on most days, and I know peanuts is a snack, but if I want to lose the weight a bit quicker, I have to balance them a little bit, and pork scratchings, which are quite heavy in fat. Not every day, but I do like them thing instead. So I have never counted carbs because I got so fed up of the calorie counting, carb counting life. You know, whatever we did, we counted it, didn't we? And I just wanted somewhere where I'd cook a meal and I knew it was okay. And this is how this works for me. I know I can cook a meal with a piece of meat and vegetables, and I know it's okay. And I only eat 2 meals a day, so the other one's usually yogurt and berries anyway. So I know that all fits in and I don't have to worry about it anymore, which is exactly what I wanted.
I was pre-diabetic and now I'm not pre-diabetic. My feet have gone from a 9 to 10 men's 5E, so extra wide, whatever that is. And now I'm a ladies size 8 wide. My clothes have gone from a 32, 34 to a 20, 24. My wheelchair, because you can't see it, I don't think, but my wheelchair has already been taken in once and it's now 4 inches too big again. When I first started with TLC, I was a very high carb vegetarian, massive carb addict, and now I'm a minimal carb meat eater. So, yeah, and it's made me feel a lot better. I now don't get continuous chest infections, ulcers, cellulitis. I don't get edema anymore. My gums rarely bleed. There's like a whole list of stuff, but that's one of the main ones. But so thank you very much. And thank you for sticking with me and not giving up on me. I really, really appreciate it.
That's why we do it. So over the last 4 years, I've learned to never underestimate what an empowered and supported individual can achieve. I'm just so proud of what we've been able to achieve with TLC, and so thankful to have been involved really from the start. And I just wish Sarah and the team and the whole TLC community every success with the next phase. And obviously I'm continuing to support from the Scientific Advisory Committee. It's just been an absolute pleasure. So thank you.
Excellent. Thank you so much, Helen. That was amazing. And Glenda, wow, that pulled at the heartstrings. It's just amazing when something like that, somebody says something like that, isn't it?